September is National Ovarian Cancer Awareness Month, and it's important to know about this type of cancer because it causes more deaths than any other cancer of the female reproductive system.
The National Ovarian Cancer Coalition is having their annual Teal Tea event on September 14th. And here to tell us about the event and the coalition are Dr. Alton Hallam from Arizona Oncology and Sherry Sheets from Tucson Medical Center. Welcome, guys.
Great,
thanks so much for making the time to come back here.
Thank you.
So tell us, why is it so important for the community and the world to be so aware of ovarian cancer? Tell us about that.
Ovarian cancer they say it whispers. It has very vague symptoms that a lot of women just simply ignore, they brush off. What woman in their 50s doesn't have bloating, doesn't have that low back pain, just that discomfort? And you have to go to the bathroom more frequently. We all do as we age. These are things that women don't even think about, and these are the symptoms of ovarian cancer.
Those are also the symptoms of ovarian cancer, because I can understand how those can just be passed off as, well, I'm just getting a little bit older and it happens.
Exactly.
That's scary.
I am a nurse, and I ignored these problems for months. If they're there for 2 weeks or longer, call your doctor.
2 weeks, that's it?
Yes.
Wow.
Yes.
That's shocking. And so what's the screening test for something like this? I mean, is there one?
Actually, there's not a good screening test. So using ultrasounds, blood tests, CA-125 is the most commonly used test, has not been shown to improve the early detection of ovarian cancer. So there's a lot of concerted effort in trying to identify an early detection system. Unfortunately, we don't have that. So the big emphasis for us in trying to be here today is to try to emphasize this education of knowing those symptoms. And if those symptoms persist, that is an attention causing thing for you to go to your doctor. So this educational process is directed both at the public and as well as physicians, because general practitioners don't necessarily think that this may represent ovarian cancer because they see a lot of patients who come in with these complaints. But if it's persistent and a patient says, you know, I'm worried about ovarian cancer, that's going to trigger a very different response from the physician.
And doctor, in your opinion, what are some of the major signs besides some of the symptoms that we as women should be paying attention to?
Well, it's really the symptoms that Sherry was alluding to. So,
are there more?
Well, bloating, early satiety, where you feel like you're eating and you can't eat as much and your abdomen gets distended. If your clothes get tight and you can't explain a reason for that. If you have problems urinating and you didn't used to. If you have problems with constipation. If you have abnormal vaginal bleeding. All of those things are things that should direct you to seek your physician's attention.
And it's awful how most of the times it's too late and it's already developed and already spread. So what are the strides that the health community is making to make screening a little bit easier?
Well, screening, again, is there's very hard screening tests to identify cancer before it spreads outside of the ovary. Those symptoms that we've been speaking about actually are because the organs that are being affected, your bowel and your bladder, are affected because the cancer at that point in time is oftentimes already spread outside of the ovary.
Right.
And so that's where most women do present with this kind of cancer. The signs to actually find cancer when it's limited to the ovary is not very well identified. About 25% of women who have ovarian cancer, it is limited to the ovary, and they may have a big ovary that's pulling or causing pain. But that's the exception rather than the rule.
Okay.
And Sherry, there's a reason why you're dressed in beautiful teal today.
Yes. September is National Ovarian Cancer Awareness, and teal is the ovarian cancer color.
Okay.
And we are having a teal tea on the 14th, and it's just, we want everybody to do teal. We want everybody to do their windows and shops in teal, just for awareness so we can get the word out.
That's amazing. And this is the 5th annual, right?
5th annual Teal Tea.
And tell us a little bit about how it started. What was the original idea behind it?
That I have absolutely no idea.
Okay.
I'm assuming that they started this off as awareness. Maggie knows all about the
Actually, there was a group of patients who served as support systems for each other, and there's a national coalition, the National Association Ovarian Cancer Coalition, that has really tried to push the effort of educating the public about ovarian cancer. So this awareness is driven as a national effort, and within Tucson, Margaret Hoft has been the main driving force for this.
So September 4th, we just want to wear teal?
The 14th.
The 14th. The 14th.
And every Tuesday throughout the year is Teal Tuesday. And then today, on Friday, September 5th, is National Teal Ovarian Cancer Day. So everybody should wear
That's
teal.
fantastic.
I should have worn teal.
You are so close with your green.
I am so
You are
close.
so
I'm not
close.
even.
I'm in the family.
I'm nowhere to be
This is-
found with my outfit.
This has been wonderful. Thank you both
Thank
for
you.
joining
Thank you,
us.
guys.
Thank you.
The 5th annual Teal Tea will take place September 14th at Lowe's Ventana Canyon Resort from 2 to 4 p.m. Tickets are $40 each, and for more information, you can call 477-1905 or email TucsonTealsTogether@gmail.com.